recorded. I am now sharing the screen. Please confirm if you can see the screen for me.
Yes, I can see it.
Thank you so much. Thank you. Okay. So here we'll start by looking at the assessment and how many marks you got. And then we'll look at the feedback. Okay, that's fine. Let's get a pen, color. Okay. So, yeah. So on the title, it shows that you got full marks, so that's fine. The reflection, you got 1, so it's 1 out of 3. Let's check what the problem is. The learning need is too specific to the case scenario. Okay, this is a common problem that I realize. The reflection needs to show the assessor what skill you need to apply for the CPT across varying scenarios and situations. The reflection needs to provide context. Okay. A learning need as specific behavioral statements, and then based off that, what you hope to achieve of your career after learning the skill. You need to be sure that you can prove, okay, this is not bad. For the planning, you also got a 1 out of 3. C. Okay. Planning refers to resources. What resources will you use and why? Give specific details of the resources, chapter, edition, sections. Refer to all behavioral statements. Okay. 1 out of 3 as well. See on the description, no reference made for at least 75% of the behavioral statements. A was done. No evidence for B. Okay. No evidence for C. This was done. No evidence. No evidence. Okay. Practice. Not enough evidence. Done. Done. Okay. Let's see where the gaps are. On the evaluation, same thing as well. How have you subsequently applied the learning need? Okay. What are your future needs within the same domain, but different competency standard? Within the same domain, but different competency standard. Okay. All right. No problem. So I think based off your write-up, the first gaps that I'm seeing is understanding the behavioral statements, and then we'll look at the evidence that you then provided for this. But the gaps is in the 4-step cycle because you keep getting one. And on the evidence, I see it's not enough and they didn't make mention of this. So I think it's understanding the behavioral statements and then also understanding annotation and how to annotate your evidence well. Excuse me. Now going back to your work, I won't go through everything in great detail. I just want to see the gaps here. All right, behavioral statement G. Okay, how this to G, C is to G. Okay. Screenshot, not link to behavioral statements, counseling session, not link to behavioral statements. Okay, patient confidentiality, not link to behavioral statements or how it's applied. Counseling questionnaire, no link to behavioral statements. So this is behavioral statement B. Okay, no clear link. Patient report, actual counseling. Patient feedback. Okay. All right. I think I see where the problem is now.
Okay.
Let's start here. So I will also be sending you this so that you can also have access to it. We'll see what's going on. Yeah, excellent. Okay. This is take blank. Okay, what I will start by doing is explaining the behavior statements for this. I will also send you a link on from my YouTube channel that shows just a summary of the behavior statements in domain 2.2. But for this session, I believe it's really important that we start by understanding all of the behavioral statements first before we start going on and then how to fix. Okay.
Okay. So I just wanted to check to resubmit this. Must I do the whole CPD again with another case scenario, or do I just edit this one?
You'll have to do it on another case scenario because it's insufficient evidence.
Okay.
With most of the behavioral statements that weren't fulfilled with, you would need to add like extra evidence and sign some documents. So if you use an older date, it will look falsified because one, the patient is left, and two, how can you show that it was the same patient, or did you apply this? So it's better to use another scenario, even if it's also on inhalers. It's perfectly fine.
Oh, okay.
Okay. So behavioral statement A speaks about assessing understanding. So in assessing understanding, you are checking what the patient understands on their condition and the medication prescribed. Then you're trying to find a counseling need. Let's say that the patient that you're counseling is newly diagnosed with asthma, and you feel like they don't understand what asthma is or the importance of, not smoking. Maybe it's a smoker, or maybe it's exacerbated by allergies, or maybe it's childhood asthma. You're checking why this patient wants to come and get counseling. Okay. So on this part, you first have to, I think you used a template on the evidence that you used, but it's fine. We'll get to that. And then you ask questions based on the medication that the patient then asked about. Let me just make this.
So that questionnaire that I made up, it doesn't count for behavioral statement A. If I label that as behavioral statement A, would that not be sufficient?
It can be sufficient, but let's see how many did not cover, because according to the feedback that you received from the assessor, there's quite a few that weren't complied with. So are you talking about this?
No, a bit more down. The questionnaire. This one.
This one
Asking
works.
the patient's understanding of their condition and the
Yeah.
medicines used and stuff.
This one works. Well, this works. This works fine. It's how you annotated the evidence that was the problem.
So can I just edit this document and explain that this section demonstrates behavioral
Yeah.
statement A, establishing existing understanding and knowledge of health conditions for the
Yes.
patients to be counseled?
Yes. Yes, definitely. Definitely. But I'll also show you and how to annotate the work. I just wanted to make sure that we cover the behavioral statements. But
Okay.
yeah, definitely can use. Okay. Normally, what I would do for sessions is that I would go through the work. If I get time, like if it's sent before, I go through the work, and by the time that we have the session, we're able to go through everything. So what I did now is go through the overall structure of your work, and I identified that yes, it's not that your evidence is not good, but it's in how the evidence was put and how it was then annotated that became the problem.
Okay.
Okay. And then on this, the counseling need is based on that form that you counseled on. What was the reason that you wanted to counsel this patient? What happened?
Okay, so I must mention that as well in the labeling.
Yeah, yes. Maybe just to discuss now for the purpose of this CPD. Was the
Oh,
patient
for
new?
this one.
Yeah,
Yeah,
was
no,
it?
the patient needed guidance on how to use the inhalers because they weren't very compliant with use. It
Okay.
was an elderly patient.
All right. So now you've got a case of non-compliance. This is a good reason for, this is a good counseling need. because the patient is non-compliant. So it's good. It's good. So you mentioned that in the work that you do.
Yeah.
Yeah. That the patient needed counseling because they were struggling to comply with the medication. Was it because they didn't know how to use the inhaler? Was it a change?
Yeah, they weren't sure how to use it.
Okay. All right. Perfect. Okay. Behavioral statement B is on the safe use. So the safe use includes like storage instructions, contraindications, and dosage requirements. So here, so you're talking about storage. You'll talk about contraindications. On this one, you can use the packet information leaflet. You can also use SAF to just check this. You can also use the standard treatment guideline or the EM guidance app to show, on this. On the rational use, it could also mean, that you're demonstrating, you're showing them how to use the inhaler. You can use the package information leaflet as well as the instructional guide inside the inhaler that you then used to counsel the patient. Yeah. This one, normally what I do for behavioral statement C is I start by including an article or a document in a book from your notes from last year that speak about, the importance of applying active listening skills and reflective listening. And then when you demonstrate, yes, when you tell the assessor what you then do, you explain that I asked the patient to say, a few questions, and they would respond. And then you maybe paraphrase the information, or you ask if this is what they said. Maybe you tell me something that, hey, this patient was non-compliant. Or maybe I ask, what is the reason that you wanted to counsel the patient? And then you respond as a patient, the patient was non-compliant. Okay, and then I note that down. I would then summarize it and say, okay, so you're saying that the reason why you want to counsel the patient is to ensure that they use the medication correctly because they're struggling with compliance. That's reflective listening. And then what they then say, they would either nod, they will nod to show that I did not, what's this thing? Sorry, just a second. They will nod to respond that I did do this or stuff like that. So that's reflective listening. Okay. And on the counseling plan, the counseling plan will be based on the counseling need. And after seeing what the patient needed counseling on, what did you then do? Did you counsel them on how to use? Did you add anything that would improve adherence? Did you speak on the importance of adhering to the medication? Did you remove barriers to adherence? There's a document. You can just create a document around this to show how you applied it.
Okay.
Yeah. Like maybe you develop a form that I will counsel the patient on 1, 2, 3. You mention those things. I don't know if there is a document that you maybe included on this evidence of yours. Speaks
A
about
document
that.
with
Like
it's basically just the questionnaire.
Oh, you had a questionnaire.
Yeah, on page 10, I think.
Page
where
10.
It's labeled counseling on the safe and rational use of inhalers.
Okay.
So I explained the difference between salbutamol sulfate and budesonide, the indication, the dose frequency, possible side effects.
Okay.
And the storage as well. I mentioned to store it at room temperature and keep it away from heat and light, and to always check the expiry dates as well.
Okay. All right.
Maybe I didn't label that part well enough.
Yeah, I think it's in how you labeled your feedback. Your evidence. That was a problem. Because it's supposed to demonstrate to the assessor that you did apply it. But I'll show you an example of how you can then do this, even with the work that you applied.
Okay.
And then on maximizing counseling opportunities, it also is making sure that you're doing it in an appropriate counseling area that ensures privacy. If there's other problems that you identify during counseling, maybe patient struggles with adherence, what then do you do to support this? Maybe you speak on the importance of adherence.
Yeah, I did mention this as well, a part of my counseling plan. My point 4 says I discuss trigger avoidance and also discuss adherence importance and the reporting of any side effects as well.
Okay. Where did you do your counseling? Was it a semi-private counseling area or private counseling area?
Semi-private.
Semi-private, okay.
But how do you show that as evidence?
Then you include section 1.2.13 of the GPP.
Okay.
This includes the appropriate counseling areas.
Oh, okay.
Yeah, appropriate counseling areas. And then making sure that you wear a name tag, you ask the patient if they have any questions, something like that. Yes.
Okay.
And then behavioral statement F speaks about you are cognizant of the fact that patients may prefer other ways of healing like allopathic medicine, complementary medicine, how to address the patient. Do they want to be addressed as Mr. or Miss? And you're not using any complex terms. You're asking the patient if they're okay about taking pharmaceutical products. For this, I don't have, because with feedback sessions, I don't normally give material. So I have material that supports all of this, but we can discuss this later. I think
I did avoid using complicated language, and I explained because he was an elderly patient to use the blue inhaler and brown inhaler. That's how I use those keywords to help them remember. And I included that also. Or maybe I needed to explain it in detail.
I think then it's in how you annotated your work that was not clear enough. Okay. And then here, also, I think it's in how you annotate it, because you're speaking about using the appropriate language that is in an elderly patient, which is the problem. Then instructional aid, I did see a leaflet that you created with Canva, so that's fine. I also saw, evidence for this one. Okay, so I think the main thing with your behavioral statements is just understanding how to annotate, because you have an understanding of the behavioral statements from our interaction now. You do, yeah. I think it's in how to annotate. Maybe let's come here. So on the reflection, on the trigger with the reflection, you speak of a specific incident, okay?
Yeah.
Like, what exactly happened that made you want to counsel the patient? So that an elderly patient comes to the pharmacy and says they are struggling to use the medication, or they still have complicated asthma, even though they were prescribed inhalers. So then you want to counsel them so that they can be able to use them correctly. That's a specific incident that happened, a specific case. Yeah. So you mention it like that instead of mentioning it as a general, something general that happened, or maybe you observe that some patients come before time, before their inhalers are finished, and you're like, hey, I need to provide counseling for these patients because they come before time and they're saying that inhalers don't work. A specific scenario or something that made you feel like I want to do counseling. Okay. On the learning need, you are speaking about the competency standard itself. You're also speaking about the behavioral statements that you want to apply. So you look at the requirement of the whole competency standard, which is, counseling, and you look at the individual behavioral statements that you feel like I need to improve my skills on. If you don't know how to, do or check reflective listening, then you speak about this, that I need to learn how to apply skills for reflective listening so that I can understand the patient. Then you can speak about.
So not specifically for asthma.
No, you don't address asthma. You are speaking about asthma in the trigger.
Yeah.
In the
And then
learning need.
in general, I must talk about counseling, as in I need to know how to use visual and verbal skills, and I need to.
Yes. Yes,
Okay.
precisely. That's in the learning need. That I need to be able to, yes, apply active and reflective listening, counsel the patient to ensure rational and safe use of medication, apply instructional aid, and at the end of the CPT activity, get feedback. You don't have to cover all of the behavior statements. Maybe you can look at 3. Maybe you're looking at behavior statement A on H on instructional aid, G on appropriate language, and I on ensuring that you get feedback. But look at the skills that you need to learn on the competency standard and the behavioral statements that you are addressing.
Okay.
Okay. On the goal, also speak about the competency standard. At the end of the CPT activity, I want to be able to counsel patients appropriately, ensuring that they understand their medication. So it's focused still on behavioral statements and competency standard. Even in this case, it's behavioral statement and competency standard as well. Okay. On this, okay, this is not in the past tense, this is in the future tense, on the planning. So the planning is divided, not divided, but yes, you write on the future tense. You mention the section, the page numbers that you included here, and you link to the behavior statement and you state the reason for this. I will then have to go through with you the first website.
It has to be like, just say, for example, page something of the good pharmacy practice, or do I just say good pharmacy practice, the section on whatever, patient counseling?
You can even say section 1.2.13, then in brackets you say page number, then you mention the page number. At the end, you link with the behavior statement that you're addressing. Let's say it's behavior statement E.
Because in my evidence, I write down the page number.
Or it's supposed to be added in the, what's this? So in the planning.
Oh, okay. But then sometimes there isn't enough characters left.
I'll show you a way to put this. Okay. So let's say that, okay, your counseling topic is an inhaler. Let me show you how I would have done it. Let's do this. Okay. So the patient presented, okay, okay, let's start. Yeah. I need to, it's raining. I hope you can still hear me.
Yeah.
Okay. So I need to be able to counsel the patient appropriately. When the patient arrives, I will direct them to a private counseling area to maximize on counseling opportunities by ensuring privacy. I will take notes to assess their understanding of asthma and the medication prescribed. Okay, let me do this. So assess the understanding of asthma, and then I will create a counseling plan based on their needs and counsel them. Okay, I will create a counseling plan based on their needs. I'll apply active and reflective listening skills by asking open-ended questions. Depending on how they respond, I will note it down, covering this, okay? I will ask about other healing customs, such as complementary medicines, and then use a language they prefer, including nonverbal cues. I will include a leaflet that demonstrate to the patient how to use the inhaler. And at the end, I will use a feedback form to collect feedback. I will ensure that the patient knows how to use the medication safely and rationally using sound, page, or whatever. But you see, I included all of them and I mentioned the reason why. Sometimes it's easier to just say that I will, like here, you probably are going to use sound for this one. And then maybe to counsel the patient, active listening, include an article. So maybe you'll say, I'll consult an article from 1 to 3 to apply active listening skills. Then at the end, you include that this is behavior statement C. Okay? Then you write a statement about taking notes where you will ask about if they know their condition, their medication, and their preferred language. and other healing customs. Then at the end of that whole sentence, you link it to behavior statement A, you link it to C, maybe people's active listening, and then you link it to G. So you do it like this. So instead of saying this is linked to, just say linked to, or in brackets put the behavior statement, or in brackets put the page numbers that you're going to then consult.
Okay.
Okay.
That makes a lot of sense. Thank you.
It's a pleasure. But I get what you're saying because it's 9 behavior statements. So in the planning, you are allowed to only mention 7. But the key is to know exactly what you're going to be talking about. So if you're going to assess an understanding using their questionnaire, then you speak on behavior statement A. But in the questionnaire, also add that you will apply active listening and ask about the language and other healing customs so that you're able to link it to multiple behavior statements.
Also, in the pharmacy, I found like a little note on a counseling plan as well that I used as a guidance, So can I make like reference to that as well? It's a 5-step patient counseling guide.
Yes, yes. But instead of using it as a counseling plan, use it for behavioral statement B, because the counseling plan will depend on the patient's needs.
Okay.
Yeah. So that plan, you can include it here. On the counseling plan, I think if you check online, just look at a template for a counseling plan, like what exactly will the patient need counseling on? Will they need counseling on their medication? Is it a drug therapy problem? Is it side effects? It's like then you make a checklist out of that. And then you use that checklist that based on this patient's needs, they will only need counseling on. Some patients are newly diagnosed, so they will need counseling on everything. Some patients are struggling with compliance, so they may understand what asthma is, but they don't see the reason for taking the medication every day. So you take on, counseling for ensuring compliance.
Okay.
Yeah. What you can do as well, use like AI tools to be like, hey, I want to create a counseling plan, based on 1, 2, 3, make a checklist for me. Then you use that checklist to tailor the needs for counseling on your specific patient. You just make it a template that you're able to take, not a pre-created template, because then it looks like you knew what you wanted to counsel on. So a general counseling plan that you use, and for your specific patient, you then take on areas that they need counseling based on that template that you have. Yeah. And then
So it must be a general one, like counsel on side effects, counsel on contraindications.
Yes. And then you just have a tick box next to it that this patient needed counseling on this, then you take, on this, they needed counseling because of the reason for counseling is maybe compliance, newly diagnosed, side effects. Then you tick on this appropriate area that the patient's need is, is it to ensure compliance? Yeah, then you tick on ensuring compliance, or however that you put it. Okay. So the implementation is written on the past in the past tense. No? You need to include the date of the counseling session. I counseled the patient on 25 April 2025 or 25/4/2026 to shorten the word count. Well, it speaks of the place. Then you mention counseling area here. And then you can mention the hospital name. That I counsel the patient in a semi-private counseling area and at name of the hospital. And then you speak of what did you do? Like you created a template, you asked questions, you then labeled the medication and then pointed on the medication as a non-verbal cue. Then these two go together because it speaks of the sequence of the events that should unfold. Asking the questions, finding the information, creating a counseling plan, and labeling, then coming back to explain to the patient, and after that demonstrating, eventually handing out the medication, asking them to demonstrate, filling the feedback, and then closing the session. Okay. So here, I will also add like some material that I have online, links to that. Let me just do it now before I forget. This material just shows that the steps that you need to follow for a counseling session, because it's important by your implementation. The structure of the structure that you follow in counseling the patient. I'm just going to link some of this so that you can see. It helps just being guidance. Do this. So while doing this, you can watch these videos here. Okay. And then some of the mistakes that interns make, especially when annotating evidence. Right here. And this is here. I think that's about it. This is just an explanation of the behavior statements, but I think you already understand this one. Okay. So now coming on the implementation, this procedure, very, very important because it shows how we then apply. The place when they always look for these things, then you link with the behavior statement here. Here's link. So after adding the behavior statement, the evidence that you link, inside the evidence, then you'll be linking to the specific behavior statement that you'll be covering. We'll go through that as well. On the evaluation, what they spoke about, okay, I think you provided this too, but the application with example and the future learning need was not provided for. So when you write your evaluation, start with, to state what you learned, then you will say, I learned 1, 2, 3. I am now able to counsel a patient, or I can apply active listening skills in counseling. I can now use packet insert as instructional aid. You speak about what you're now able to do because you counsel the patient successfully, remembering the behavior statement. So you think of a behavior statement that you cover. Yeah. And then on the future with example, you're speaking about another case whereby you applied these skills. Okay. So you're going to talk about maybe counseling another patient, maybe on diabetes, or maybe counseling a patient on hypertension. When you're counseling this patient, what did you then do? You maybe created, took a template, counseling notes, and then obtained feedback. Or maybe you asked open-ended question, then noted down their counseling. So you just provide a brief summary of what you did. Sorry?
I have to give details on that as well.
Sorry, I can't hear you well.
For the future like, practice, do I need to give examples of what other cases I did?
Yes, you just make another example of another case beside this one that I applied the skills in activity 1, 2, 3. You mentioned the activity where you applied it. And then the future learning need is in this domain, what do you want to learn about? Maybe you want to learn more about, motivational counseling to improve adherence. Motivational counseling. Or maybe counseling in a different language. In a different language. Because this is related to the specific behavior statement, I think behavior statement G. So learning about the skills improve your counseling skills. So it should also be related to the activity of counseling, not just, asthma. And sometimes when you put your work on ChatGPT, it's going to change the structure of how you want to put stuff. Going to make it look, strange. But yeah, this is good. So once you have the structure, knowing what the requirement in each behavior, in each step of the 4-step cycle is, saves you a lot of time, honestly. I think I was covering this in the masterclass that I had on Saturday, focusing specifically on this because they look for these things. Now that I see that, they gave you 1 out of 3, it's probably because in how you wrote your 4-step cycle, you were missing some of these points. Like in the 4-step cycle, I saw that you were not including the page number and the link to that behavior statement that you're covering by including that piece of evidence. Okay. And then now coming to your work, I'm going to give you a checklist for annotation. Let's call it an annotation checklist. The first thing that we're looking for, we'll look at the title of your work. 2, we are going to look at what it is. And then we look at application. And then we look at link to the behavioral statement. Okay. When we're looking at your work, before I even check anything, I'm looking at the title. Okay, this is evidence 1. Let me just change the color. So, this is evidence 1. Okay, it's the title of the evidence. This is chapter 16, page this. So this stuff is what's supposed to be in the planning. Okay. And then you are saying that this links to behavior statement G, using language, including verbal and non-verbal cues that the patient is likely to understand. But you're including the standard treatment guideline. How does including standard treatment?
I thought that behavioral statement was to choose one for the entire CPD, and then all our evidence must include the other behavioral statements as well. But the main one is to use verbal and non-verbal.
Oh, okay.
I think you might have been confused.
Yeah, okay, all right. All right, then in that case, what they're looking for is this. They're looking to see that if you include the standard treatment guideline, what behavioral statement is it covering? Okay, if you referred to this section so that you can counsel the patient on what asthma is, then you link it to behavioral statement B because you want to understand asthma, or maybe the patient needed to understand what asthma is so that you can counsel them accordingly. Okay? And then on the general measures, you can see that, okay, patient education, including advice on smoking, decreased exposure to triggers. This is behavioral statement E. Behavior statement E is about maximizing counseling opportunities. Maybe that during the counseling session, you saw that the patient was struggling, with smoking or was not able, was smoking. So you maximized by counseling the patient on the importance of stopping smoking. You also maximized by explaining on the triggers. So you link to behavioral statement E, and then next to it, you add your annotations like you did here. Okay, the trigger and smoking cessation are mentioned to the patient to manage asthma. But why are you mentioning it to the patient if the patient is not struggling with smoking? If the patient struggled with smoking, then it's something that you could say. Let me make an example of this now. The standard treatment guideline, I would have linked it to behavioral statement A. I would have linked this to behavioral statement A. And I would have linked this, like I said, behavior statement E. In how I would annotate, I've already included the title and what this shows. Okay, so for B, I would say that I counsel the patient on asthma and the importance of managing their asthma to ensure that they know the importance of managing it. I then told them how to use the medication safely and rationally, linked to behavior statement B, because that's the requirement. I said what's happening. I then show my application. I counseled, I did 1, 2, 3. And then here, since the patient did not understand what asthma is, or maybe they didn't understand, I then asked, what they understood about asthma, when it started, how it was managed and stuff like that, to check their general understanding so that I could know whether it was asthma that was exacerbated, childhood asthma, or, due to allergies and stuff like that. When I saw that the patient did not have a clear understanding of asthma, I then established a counseling need linked to behavior statement A. I am looking at the behavior statement, and then I am applying the requirements of that behavior statement in my annotation. I then did 1, 2, 3. I asked the patient 1, 2, 3, then did this. Okay. Let's look at what you then said. A description of asthma and the difference between asthma and COPD. I read this to have a background understanding between patient file to see if they align with the diagnosis and treatment plan. If this was the case, then you link with the behavior statement that you were addressing when we were talking about this. You see, this is good work. If the patient did not understand asthma and you were asking questions after reading this, you link this with behavior statement A because you want to ensure that you counsel them correctly. Okay. Important points for me to ask when counseling. So now it looks like you have not done this activity. It looks like it's still something that you're going to do. So your annotations are supposed to be written in the past tense. And also, when you're saying this, what behavior statement does this link to? If you're saying this so that you can counsel the patient accordingly, then you link it to behavior statement B. Also, by linking to behavior statement B, what did you do? I looked at these notes considered, and I saw that the patient was diagnosed with asthma. After checking the patient history and the fact that they live in an area with allergies, I counseled the patient on the importance of minimizing the allergies and ensuring they take their medication correctly to minimize on the symptoms worsening. Okay. Let's continue with the other ones.
CPD submitted, I didn't mention each behavior statement. I mean, I applied it in my evidence, of course,
Yeah.
but I didn't label it saying behavior statement A, B, C. I did have to. I think that's why I put it. But for this one as well, I didn't have to.
Yes, because even in the feedback, they spoke about, okay, applied, not applied. It needs to be in how you say the work. Yeah, you need to mention how you said the work, like how you applied this. Okay. So now, you see, they're speaking about non-steroidal anti-inflammatory drugs. You could mention something about this. Maybe in B, you can ask the patient if the patient is, the elderly, normally they take diclofenac and all of these things. So you can ask questions to a certain, understanding of the medication. Do you use, what's this, diclofenac? If they say yes, then it's a counseling need. And then you can apply this by explaining on the importance of avoiding these drugs. Okay. Yeah. And then, yeah, stuff like that. Correct technique. Then here you speak about behavior statement H, that I demonstrated on the correct technique using an instructional aid so that the patient can understand. Adherence to medication, especially inhaled corticosteroid. Then here you can speak about behavior statement B. When I asked the patient, I saw that they struggled with adherence. I then focused maximizing on counseling opportunities. I then added an article for the patient that educated them on the importance of adhering to medication. You include that article so that they know this. Okay, let's see what you then said in your questions. Important points to note when counseling. Now, it still looks like something that you are going to do in the future. So I think that was the problem, that it looked like something that you didn't apply. Okay, I also asked about other medical condition they have and reviewed other medication they take. But what behavior statement is this linking to? Is it behavior statement A? And if it is, how? By asking about their medical condition and reviewing other medication, you are checking their understanding. So this was clear application of behavior statement A, but it was not explicitly stated in your annotations. So maybe you could have phrased it as, during the counseling session, I demonstrated the correct inhaler technique. My goodness, it's already here. So behavior statement H, Then you link. I asked the patient open-ended question on their adherence and exposure to triggers. I did this to apply, active and reflective listening. So you link to behavior statement B. After they said this thing, I then paraphrase the information. Depending on how they responded, I then noted it down. I looked out for nonverbal cues such as nodding to confirm understanding. So you see, I am not just saying, because it's already here, but how you then annotate it. Okay. So after this statement, you can then say linked to behavior statement H. And then after that, I ask the patient open-ended question, then linked to behavior statement C. I also ask the patient about their medical condition, linked to behavior statement A. How they answer, I listened actively while they answered. And when they answered, I paraphrased the information. And then I asked if this is what they meant. And they said yes. I did this to apply active and reflective listening skills. So I think the main thing here also in your evidence is how to annotate your work. Remembering the title, application, and link with the behavior statement. Okay. This had to be explained. Okay, you speak on what you did. You already did this. You're not speaking about what had to. You're showing the assessor that you apply. It's a title. What this shows. Okay, for example, when treating asthma, they used a short-term acting B2 agonist such as da 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 and budesonide da 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 da. I then applied this when counseling the patient. I explained that this is the controller. I then also explained that this is the reliever. The controller is supposed to be used every day. The reliever is supposed to be used whenever it's necessary. I asked the patient if they understood this, and they confirmed by nodding. I did this to apply behavior statement B and behavior statement G, which is nonverbal cue, by them nodding. Okay. I think, yeah. Created in isiZulu. Okay, is this the language that the patient wanted to speak in?
Yeah.
Then you link it to behavior statement G. I asked the patient what language they preferred using, and they said G. I then created a leaflet in isiZulu to explain this. This is also an excellent way to include behavior statement H on instructional aid. Because you are speaking about, you're using this as a way to educate the patient. Yes. Yes. Okay. Okay, the sum can be used for behavior statement B because you're educating them and you're educating them about the side effects here. And then patient requiring repeated cause of corticosteroid, okay. This, you explain that linked to behavior statement B. I explained to the patient that after this, they need to rinse their mouth because if they don't, then it could lead to a fungal infection. Okay. And then the dosage was given as 200 micrograms according to the doctor. So it was within the limit linked to behavioral statement B. Then you explain how this is linked. Okay. And please try to annotate each and every page. The best way to annotate the work is do this, okay? Maybe you are going to highlight this. You want to link it to behavioral statement B, and then you add a text box next to it. Maybe the text box is here. And then you link to behavioral statement B, and then you explain how it's linked. Here, I educated the patient about the adverse effect, which included tremors and nervousness. I asked the patient to not be alarmed. I educated them not to exceed the maximum daily dose because if they do, they could experience 1 to 3. I looked out for nonverbal cues such as nodding, and the patient saw that they understood. That's how you then show assessor that, hey, I applied the requirements of what you asked me. The key is understanding the behavior statement that you are covering, and speak on how you applied it. They want to see application. Okay. So same thing as well. When you come here, remember the checklist. There is a title. Okay. What the title shows, I'm seeing this, but I'm not seeing which behavior statement this links to. Okay. So here, I think this could be a feedback. This is a feedback form or a counseling guide that speaks about how the patient could have been asked, okay, maybe this is something that you ask the patient, and then at the end, they sign. You're asking this question where you explain on the purpose of each medication. Maybe there's a checklist here that says yes, no, okay? And they tick yes. Where you explain when to take the medication, yes. Where you explain how to take with or without food, yes or no. And then at the end, they sign. And then you mentioned that I use this as a feedback form to get, to see if the patient understood this, okay? So let's see what you said. These points were covered during my counseling plan. But this can't be a counseling plan because a counseling plan is something that you are planning to do. A feedback form is something that you use to obtain feedback from the patient that you counsel. Okay. Looking at our time, so I won't dwell a lot, but I think I hope you understand what I'm trying to. Yeah. Yeah. So this could be used as an instructional aid. You are explaining to the patient because this looks like something that you could have said to the patient. But since you already have other pieces of evidence that would cover this, such as this one, you see, this could have been used as an instructional aid, or you could have included the instructional aid. I think you've already covered it already when we were checking. Yeah. So this prescription could be for behavior statement A. So if it's behavior statement A, we are going to look at reasons why this is behavior statement A. Okay. So now we are going to say that this patient is diagnosed with asthma. So we see that this patient is asthmatic. They probably understand what asthma is. And then we're going to look at other things that would want us to counsel the patient. Okay. So here, maybe there's this. Okay. But the doctor did not write the directions on how to take this. So this, unfortunately, can't be used as a proper prescription for this because the doctor did not indicate the dosage. If it's a case like this, then you then make mention that I communicated with the doctor to indicate the dosage instructions for these inhalers. I'm not sure why it's cancelled out.
I think that was the labeling that.
Okay, all right. Yeah. So after this, you could include maybe like notes here. I communicated with the doctor and asked for directions on this. And then when I asked the patient said that they understood the other medication, but they were struggling to comply with the inhalers because 1, 2, 3. I then used this as a counseling need. Then after explaining that, you link to behavior statement A. And then, yes. And then, okay, oxygen saturation, it's 98%. And I'm not sure, you know, why this patient would need counseling on this, but it's fine. It still could be used. Okay, it's signed, there's quantities, okay, patient and a history of diabetes. So this is not the focus for the CPD, but I'm glad that you did it like this. The main one is looking at the instructions and the dosage so that you know how to explain to the patient how to use the medication safely. Okay. This one linked to behavior statement A. Okay, I'm trying to rush because I have a client now at 8. I'll try and cover everything. Okay. Counseling when they say this is behavior statement D, because this is what you are explaining on. Excellent work. This one, you linked to behavior statement C and you explain how. I used open-ended questions. I used reflective responses by paraphrasing and allowing the patient to do 1, 2, 3. I clarified misunderstanding. You see, you add annotation on how this was then applied. This, your work is good. I think it's the annotation that set you back. Okay. Patient does not smoke anymore. This is good. So you link to behavior statement E. I maximize on counseling opportunities by discussing triggers, and discussing the importance of adherence. This is what you then explain, not just ticking here, but you add extra annotation. This is where you can tell all the stories that you want. Next to it, add a text box. Yes. Link with behavior statement E. And then explain how this is linked. Yeah. Yeah. And then appropriate language communication and instructional aid. Okay. Yes. Then you link with behavior statement F. I avoided medical jargon and used simple terms. I told the patient that to use this blue inhaler or the brown inhaler when and when. I took note of cultural sensitive what's this information by asking them what they asked me to refer me, how they would want me to address them. And they said they preferred madam or, stuff like that. I maintained eye contact. So here, maintaining eye contact is related to behavioral statement G. So you use this evidence of yours to link with the behavioral statement. And after that, you add your annotations and then you explain how. I maintained eye contact. I used appropriate body posture so that they could understand the information. In the leaflet, I used isiZulu and English because 1, 2, 3. You're also linking it to behavior statement G. I provided a leaflet. You link to behavior statement H because it requires you to add an instructional aid. This way of annotating here is okay, but it limits you on how much you can explain your evidence. Because here you could have linked it to this. Here you link it to E, and like that. Sorry? I think there's a problem with the network because I can't hear much of what you're saying.
Oh, the information that's
Yes.
required is there, but it
Yeah.
has to be labeled more clearly and more
Yeah.
descriptively.
Yes. Yes. Yeah. This link to behavior statement I because it's how you confirm the understanding. No questions from the patient. And then now maybe you can add like a signature of the patient like, here to show that they were cancelled. This is to validate the evidence. The patient's name and signature, but you're going to cover it though. But it's just so that you can be able to
In
demonstrate.
the ending, I do have a few section with the also initiate.
Yeah. Yeah. So this is good. You can do that. And then the leaflet, you link to behavior statement H because it was what you use to explain to the patient. And you take pictures. Okay, let's see. Ah, excellent work. Here, you link with behavior statement G. This is on, appropriate language, and information. And then here, you mentioned that it's a semi-private counseling area because it's a window format. You use behavior statement E, maximizing on counseling opportunities. Yeah. And then here, brown inhaler. But explain what you said to the patient. I explained to the patient how to use the brown inhaler. I told them to use it every day as a controller because it prevents recurrence or whatever that you can say to, yeah. And then you pointed on the administration side, or maybe you're pointing here, or maybe you're directing it to your face. Or maybe you also mentioned, wearing a coat, maximizing, and then maintaining eye contact. You speak about this. Why are you speaking about eye contact? Because you're speaking about behavior statement F, maintaining eye contact while talking to the patient. Counseling feedback, behavior statement I. I think the main thing was how good. Yeah, this is good. This is good. I think it's in how you phrased your work that was a problem. It should be okay. Yeah, should be okay. Sorry, you were saying?
Understood. So I have to redo the entire thing or just edit.
Yes, yes. I would suggest you redo the entire work. Maybe even if you do it with a different patient, it's fine, so that you can have different dates. And then include the labeled products, okay? So use a different prescription, make sure the prescription complies, add labels on the medication, and then, also add warning instructions and stuff like that. But you can use the information that you used here and add better annotations because the forms that you used are okay. Okay, well, I think the other thing you can do is add a date. Okay, here. Yeah, here. But on all the forms, make sure there's a date.
And the counseling plan is more generalized, but not specific for one case.
No.
Diagnosis. Okay.
Yeah, it doesn't have to be specific for one patient. It can be something general that you did. You see, like how you did here. Ask the patient about their medical history, and then after this. So after making this general one, counsel the patient on the medication, include the side effects, counsel in an appropriate counseling area. Then you add the notes that the patient needed counseling on 1, 2, 3. The patient will be counseled in English because, yeah.
Thank you so much. It's
No,
really,
it's a,
really big help.
I'm
Seems like
glad.
I have a clearer idea of what to do.
Yeah, yeah. You are on the right track, honestly. I think sometimes tutors don't spend the time to go through all the work because with CPD, you need to first understand it as a tutor before you can provide guidance to the intern. But I'm glad. Yeah. Okay. I will send you the recording now. I'll send you a link on YouTube. It's private, so no one sees but you. And I will also send you this template so that you can refer to it as well. Okay.